Good afternoon. The Senate Finance Committee is now in a voting session. We've got a supermajority of the membership here, and we'll start with which analyst?
Nathan.
All right, Nathan is going to do his bills first.
First up is Senate Bill 2, for which there's a reprint in front of you that reflects amendments from the bill's sponsor, Senator Augustine. As amended, Senate Bill 2 authorizes a petition for emergency evaluation to be provided as an electronic record, which is defined in the bill as a document communicated, received, or stored by electronic means. Accordingly, a peace officer may use an emergency petition in the form of an electronic record that is transmitted and received electronically, and an emergency facility must accept an emergency evaluee if the petition is properly executed, including a petition in the form of an electronic record that is transmitted and received electronically.
All right. Do we have any motion? Senator Augustine?
Thank you, Madam Chair. I would move favorable on it as amended. It doesn't change how petitions are created. It's just modernizing.
All right, we've got a motion and a second. If there isn't a lot of opposition, we could just ask you to raise your hands. So if you're in favor of the bill.
We have to adopt the amendment first, or?
We did it.
But we did.
As amended.
All right, so this is unanimous, and so Senate Bill 2 has passed. All right, what's next?
The second bill is Senate Bill 12, for which you also have a reprint that reflects amendments offered by the bill's sponsor, Senator Augustine. As amended, Senate Bill 12 requires the Department of Health, in awarding grants from the Behavioral Health Crisis Response Grant Program, to require proposals to include response standards that prioritize mobile crisis units over law enforcement when responding to individuals in crisis. The definition of mobile crisis team is altered to prioritize limiting the interaction of law enforcement with individuals in crisis, and each public safety answering point must develop a written policy for calls that involve an individual suffering an acute mental health crisis that includes the procedures to triage the call, the resources available for dispatch, and procedures for making a dispatch decision. Uncodified language requires each PSAP to submit its written policy to MDH to make the policy publicly available, and then requires MDH to submit the policies to the General Assembly.
All right, okay, Senator Augustine?
Thank you, Madam Chair. There is an amendment as well that was here. If you all recall, there was testimony from MACO where they had some concerns, and so we added language that they are comfortable with, where, you know, such that it allows for all the programs to continue, and if they don't have the funding, that it still allows for law enforcement to be a part of it. So they were comfortable with that. We made that update. This is about mobile crisis units, not CIT, and so I just move favorable as amended.
All right, Senator Reedy?
And so I'm looking at the amendment. So when we say prioritize mobile crisis units over law enforcement when responding to individuals in crisis, that's what it says. So it's basically, these are grants for helping with things that will help people in crisis. They're not taking any grants away from anything else. It's focused on people in mental health crisis, basically.
That is exactly right. Yes,
Okay,
sir.
just checking. Thank you very much.
All right, so we've got a motion. Did we get a second?
No, not yet.
Second.
All right, Senator Feldman has seconded. All in favor, raise your hands. All right. It's unanimous.
Senator Augustine is on a
Well, I think his role just ended. All right, we're going next to Senate Bill 94.
Senate Bill 94 establishes the Maryland Suicide Fatality Review Committee to identify and address factors contributing to suicide deaths and facilitate system changes in the state to prevent suicide deaths. The Department of Health must provide staff for the committee. Last year, an identical bill passed the Finance Committee and the Senate unanimously.
Okay, it's been moved and seconded. Is there any discussion on the motion?
Do you think anybody would go on as a co-sponsor? It's good,
Cynthia, you want to speak up? There-
I wouldn't mind having my name associated with this topic, so I don't
Okay,
know
so if
anybody
you
else would.
are interested in being added as a co-sponsor, please raise your hand if you aren't on the bill. All right, but then that looks unanimous, doesn't it? Okay, all right. Considering that every member of the committee now is on as a co-sponsor, we'll take it that that's a unanimous vote for the bill. Thank you. Okay. All right, we're going now to, Senate Bill 164.
Senate Bill 164 lowers the minimum non-forfeiture rate for an individual deferred annuity contract from 1% to 0.15%. This is the lowest interest rate guarantee an insurer can use in an annuity contract when determining the cash value upon surrender of it. The bill is prospective in application and doesn't apply to existing annuities, and it aligns with the change in an NAIC model law governing these products and is responsive to the drop in rates on bonds that began in the late 1990s. These are the investments that annuity insurers use to back annuity obligations.
All right, is there any discussion or is there a motion? Senator Bottle has moved favorable. Senator Kramer has seconded. Let's see if you can raise your hand to indicate your support. All right, that appears to be unanimous. Okay.
Senate Bill 173, the next bill on the list, alters the required composition of the board of directors of a nonprofit health service plan. These are the statutory provisions that govern the board for CareFirst Blue Cross Blue Shield. The bill specifies that the board must have between 11 and 23 members instead of being required to have 23 members. It also increases the maximum number of provider members from 4 to 5 and clarifies that the board must seek to include individuals with a diverse range of experience relevant to the mission of the nonprofit health service plan. There is an amendment that makes a technical change, and it also specifies that the board must include 3 consumer members who are either subscribers or certificate holders of the plan or its affiliates at the time of their election to the board.
All right, Senator Feldman and Senator Reedy.
Yeah, I just want to clarify, so the amendment adding consumer members, that was from the AG's office submitted testimony recommending that, and CareFirst was fine with that, so in
Okay.
any event.
So the AG and CareFirst made that recommendation. Senator Reedy?
Yeah, just curious, I was looking at this earlier, what groups does this apply? Are there other groups, or is this just CareFirst basically that fits this description?
Just CareFirst.
It's just CareFirst, okay, all right.
All right. Are you ready for the vote? We-
Favorable.
All right, we got a motion. Do we have a second? All right, it's been moved and seconded, favorable. Let's see what we'll see with the raising of the hand. All right, that's unanimous. Thank you.
Senator Feldman's on a roll. Which just ended.
We all have to get 2 before they get any.
Okay, we're now going to Senate Bill 169, State Autism Strategy Revisions.
Okay, Senate Bill 169 was heard last week. It's a department bill that makes several clarifying and technical changes to the state coordinator of autism strategy and the related advisory stakeholder group that looks at autism issues in the state. All this was, this is an ever-evolving process apparently, because there's always legislation every year to modify and alter the duties of this group. This bill moves everything from the state government article moves everything to the state government article from the Human Service article and falls under the Governor's Office of Community Initiatives. It alters the reporting date. It adds 1 senator and 2 delegates to the advisory stakeholder group, so you all can have some input into what they're doing. And the governor, it sets parameters for how the governor appoints the chair and sets the terms of the chair to 2 years and related technical changes to that situation.
All right, all right, we've got a motion and a second. Any discussion on the motion? If not, then I invite you to raise your hands if you're in favor of the motion. Oh, that is unanimous. All right, next we're going to Senate Bill
200.
200.
Senate Bill 200 concerns the prescription drug monitoring program. You haven't heard from them for a while. This is a bill that actually doesn't have any opposition. Usually the PDMP bills have opposition. The bill, the Health Department, it's a departmental bill, and the Health Department testified that they can track the distribution of naloxone from local health departments and at pharmacies that serve Medicaid patients, but they have no way to track the distribution of naloxone from pharmacies through private insurance or just that are dispersed by a standing order. So what the bill does is it authorizes this data to be collected by the program, the PDMP program, but it does provide various protections for this data that is transmitted. It can't be used for any prosecutions, civil actions, or law enforcement activities, and it has to be aggregated. The data as submitted to the program by the pharmacies has to be very private. All personal information is deleted, and it's used strictly it will be used strictly to track how naloxone is distributed from this end of the process, from private pharmacies under private insurance, or just somebody who goes up to a pharmacy to get naloxone under a standing order. All these pharmacies are operating under a standing order from the Deputy Secretary of Health to distribute naloxone to anybody who goes up there. They have to pay cash or through insurance from a pharmacy. Otherwise, they can get it free from a local health department or somebody who goes to a local health department who then distributes naloxone to folks.
Thank you. Is there a motion? Senator Bidle?
Second.
And Senator Klossmeyer has seconded. Any discussion on the motion? If not, all in favor, please raise your hand. Okay, it's unanimous. All right, and then finally, we have Senate Bill 467. Oh, no, this is a re-referral to EHE.
We have 213.
Okay, all right, 213. Yeah.
This bill was heard the first week of session, and it was asked to be held the next week during the first voting session by Senator Hayes, who had some concerns about the commission's activities and regarding diversity and how they're functioning in Baltimore City regarding appraising properties. So, working with Senator Hayes, there is an amendment that adds to the bill. It does two things. It extends, instead of 2033, the amendment would extend the commission to 2025, and then it would require the Maryland Department of Labor to hire an independent consultant to do an independent evaluation of the commission regarding its adhering to the most recent uniform standards for professional appraisal standards of diversity, equity, and inclusion in its regulation of appraisers and appraisal management companies. The evaluation will basically be overseen by the Office of Program Evaluation and Government Accountability, which is an arm of the Department of Legislative Services. They're willing to write the proposal to hire the consultant, select the consultant, oversee the activities of the consultant. The only responsibility for the department here would be to pay for the evaluation. And the language goes further to say that labor would have to pay for the evaluation, and they may use funds from the special fund that is used to fund the operations of the State Commission of Real Estate Appraisers, Appraisal Management Companies, and Home Inspectors. And the evaluation should occur sometime this year and be ready for consideration by the General Assembly during the 2023 legislative session. It also changes the effective date of the act to June 1 from October in order to allow time for the evaluation to occur.
Okay, is there any motion? So we've got something to discuss. Senator Hayes? Okay, do we have a second? All right, we've got a motion and a second by Senator Benson. Any discussion on the motion? If not, if you're ready to vote, let's raise your hand if you're in favor of the motion. All right, that's unanimous. Thank you very much. Okay.
This bill was assigned to Finance. It concerns the Home Improvement Commission. Finance doesn't do the Home Improvement Commission. That's the responsibility of EHE. So you have to, we missed the two-day, administrative re-referral process. So you have to actually vote this bill out of committee for re-referral to.
Okay, so we need a motion to re-refer this bill out of this committee into EHE. All right. And
Madam Chair, I thought the Senate President said that they're overburdened, that
well, it still has got to go where it belongs. All right,
You'll be getting a few from them, so.
all right.
Okay,
Wait a minute, we just need to move this and to vote on it.
okay, move to re-refer, send it on. All in favor?
All, okay, that's unanimous.
That ends our voting session.
This ends our voting session, and thanks so much, colleagues.